With me now is Dr. Christopher Labos. He's an epidemiologist and a cardiologist. Doctor, good morning. Thank you for being with us.
Good morning.
So, Hamlin suffered what doctors are calling a cardiac arrest. Can you explain what that is and how is it different from a heart attack?
Right. So a heart attack is when you have a blocked artery in your heart. Now, it can often lead to a cardiac arrest, but a heart attack is a blocked artery. What happened in this case, and we have to speculate a little bit. Obviously, I wasn't there, but it looks as if what happened to Hamlin was that he suffered an arrhythmia, so his heart stopped beating. And the question becomes, well, then what caused it? And it seems as if in this case, what probably happened is that he suffered commotio cordis. And what that is that when you get a blow to your chest, right over your breastbone, just over where your heart is, if you get that blow at exactly the right place, at exactly the right time, at exactly the right moment in the cardiac cycle, you can actually provoke an arrhythmia. And when you provoke an arrhythmia like ventricular fibrillation, essentially what happens is your heart stops beating. And when your heart stops beating, it stops pumping blood to the rest of your body. You have no pulse, you have no blood pressure. That's why somebody collapses and goes into cardiac arrest. So in this case, although we speculate, but looking at the footage, it looks as if the blow that he got to his chest when he made the tackle just by a consequence of bad luck was just enough to provoke this arrhythmia, which is why he went into cardiac arrest and had to be resuscitated on the field.
So, we're not talking, doctor, about some sort of underlying condition here.
No, well, now we have to speculate, but we don't. He wasn't known for any of that from what the news reports are telling us. So now, when young athletes do collapse during sports, which does happen, sometimes they have an underlying condition called hypertrophic cardiomyopathy, where the heart is thickened. That's a genetic problem that they were born with, and that puts them at risk for arrhythmia. Commotio cordis, if that's exactly what happened here, somebody has usually a structurally normal heart. There's nothing wrong with him. It's just that that blow happened at exactly the right place at exactly the right time in exactly the right window of the cardiac cycle when you are vulnerable for arrhythmia. So a bunch of different things have to happen wrong in quick succession. And you often see it in sports like this where there is trauma. You talk about it in football. The prototypical example actually is in baseball, a pitcher who gets a baseball straight to the chest. That would be the type of trauma to the thoracic cage that could provoke an arrhythmia like this.
Doctors there on the field
Mm.
worked on Hamlin, I believe, for almost 10 minutes. During that time, Dr. Labos, were they trying to get the heart to start again? Was that their focus?
Yeah, so when somebody's in ventricular fibrillation, their heart is not beating. The way you fix that is you apply a defibrillator and you shock the heart back into normal rhythm. So a defibrillator is essentially what people see on TV, where the doctors take the paddles and give a shock to the heart and yell clear. That's what a defibrillator is. An automatic electronic defibrillator, an AED, which is what I believe they used here, just does all of that automatically. But it's essentially that. You need to provide an electrical shock to the heart to reset it into normal rhythm. The reason why the prognosis of commotio cordis has actually improved substantially over the past 30 years is largely due to the fact that these types of devices, these defibrillators, these AEDs, are now much more common than they once were. Without a defibrillator, you can't really reset the heart rhythm. And so the person who suffered commotio cordis is going to have essentially no blood flow to their brain for a long period of time. But if you can apply a defibrillator quickly, as seems to have been done in this case, you can actually restore the normal heart rhythm and minimize the amount of time when the person's brain is deprived of oxygen. So the quicker you can apply that defibrillator, the better the prognosis is. And that's why the prognosis for this condition has increased substantially over the past few years.
What are the chances of a full recovery?
So the quoted survival rate is 58%, and that's an improvement over what it was decades ago when it was far, far worse. It largely depends on a number of factors. The youth of the patient is obviously helpful. If you have no underlying medical problem, that's obviously helpful. But the biggest factor is how quickly the heart rhythm was reset. So if it was reset very quickly, as again appears to have been done in this case, the prognosis might actually be quite favorable. So that's what I think everybody's is hoping for.
Dr. Labos, thank you so much. Dr. Labos is an epidemiologist and a cardiologist.